Right to Health Bill of Rajasthan. The Right to Health Bill of Rajasthan, also known as the Rajasthan Guaranteed Health Services Bill, was introduced in the Rajasthan Legislative Assembly in 2019. The bill seeks to provide the citizens of Rajasthan with guaranteed access to a set of essential health services. The key provisions of the bill include universal access to free healthcare services. The bill aims to ensure that every resident of Rajasthan is entitled to free healthcare services, regardless of their economic status. Guaranteed health services. The bill specifies a set of health services that are guaranteed to all citizens, including preventive, promotive, curative, and rehabilitative services. Quality healthcare. The bill emphasizes the provision of high-quality healthcare services to all citizens and establishes standards for healthcare facilities and services. Accountability. The bill establishes mechanisms for ensuring accountability of healthcare providers and facilities, including the creation of grievance redressal mechanisms and the establishment of a state health advisory council. Financing. The bill proposes a financing mechanism for the provision of healthcare services, including a health cess to be levied on certain goods and services. The bill was passed by the Rajasthan Legislative Assembly in December 2019, but is yet to be signed into law by the Governor of Rajasthan. If implemented, the bill has the potential to significantly improve the healthcare outcomes of the people of Rajasthan.